Dear teachers and participants, welcome to this international multidisciplinary summer school, Systemic Design for Health. I will give you an introduction to the summer school program and the expected outputs. My name is Koen De Wandeler. I'm an associate professor with the Faculty of Architecture at KU Leuven, Belgium. Today, I will give you an overview of the partnership between KU Leuven, Thammasat Design School, and Techne, briefly touch upon the 2022 joint summer school experiment, then go into more detail about this year's summer school program, which involves the in-country learning modules and case study in the first half of July, and the joint workshop at Thammasat Design School campus in the second half of July. And I will wrap up with the overall schedule of the 2023 summer school. Basically, Thammasat Design School and the Faculty of Architecture of KU Leuven have started collaborating since 2020, which was about the same time as Techne was set up by the WHO in response to the urgent calls from member states to assist them in the technical and infrastructural difficulties they had in answering to the COVID-19 outbreak. At the faculty level, we were soon supported by a university-wide agreement between KU Leuven and Thammasat University. This allowed us, in collaboration with Techne, to set up the first experiment of the summer school in 2022 and elaborate this experiment in the present summer school, as you can see here. Meanwhile, Techne had expanded its horizon from working exclusively on COVID-19 to work more broadly on emergencies and epidemics, to include primary healthcare, and more recently, to focus also on the physical and mental well-being of staff and patients. In the 2022 summer school, we gathered 23 students from Thailand, Belgium, Vietnam, Cambodia, and Myanmar. The outcomes of this summer school were reported by WHO, were reported also in a small booklet that you can find in ESU, and also in an academic article that is submitted for peer review, and more recently by my colleague Adrian. He will present the outcomes of that summer school at the AXA Teachers Conference in Reykjavik. Now, for this year's exercise, which is quite complex, we will ask you to illustrate, document a primary healthcare facility in your country, preferably one that is situated in a suburban or rural area. So for this assessment of the facilities, the human resources, and the health threats associated with this primary healthcare facility, you will receive inputs from Techne, from the WHO country office, Thailand, from the Ministry of Health, Thailand, and also from the organizing universities being KU Leuven, Faculty of Architecture, and Thammasat Design School, as well, of course, of your instructors. You will focus on a case study, which you will observe and gather data about it according to a well-determined, well-delineated outline. And then in the second half of July, you will all gather at Thammasat Design School for comparison of these case study and fine-tuning the checklist that you have been conducting on your diverse case studies. This will then be taken up while you have gone home already, will be taken up in an intermediary consult with WHO, with TECNE, with medical experts and technical experts, as well as people from the Ministry of Health of Thailand. That in turn will help you next year. The participants of next year will help them to illustrate a case study, the same case study as the one that you have been working on this year, and again go over the preliminary case study, the preliminary checklist that you've been elaborating this year, and bring it all together at Thammasat Design School for preparing a design brief, which we hope that WHO will adopt and disseminate among the member countries of which you are all part. Now, to go in more detail, you will receive a number of modules. Modules on, first of all, the introduction to the workshop, the orientation of the work that has to be done, a module on specifically on infectious disease prevention and control, one on natural hazard preparedness, and one on resilience to climate change and green decarbonized design. Finally, I will give you an introduction to systems thinking and systemic design together with my colleague Adrian, so that you are prepared to conduct your case study in your own country, which of course will basically be coached by your local instructor. Moving on from that, we will all gather in the Thammasat Design School and compare notes. Basically, in the first week, we will present our case studies, we will compare them, we will sort out what are the problematic issues, what are the convergences, the similar findings or lack of data, and we will then present that in a midterm presentation after applying it to the Thai case study. We will then work towards an improved checklist that your colleagues next year will be able to update. So the final output for this, the expected output for this year will be an improved checklist and a more detailed approach of the systemic analysis of the environments at different levels of the case study that you have studied. And this all results in an overall view of the summer school being the first 2 weeks conducted with online modules that you can view at leisure, but every 2 modules approximately will be detailed in question and answer live module, which always will take place on at 2 o'clock p.m., 2 o'clock in the afternoon at Bangkok timing. And then in the second half of July, we will all gather in Thammasat Design campus, where you will basically receive accommodation on campus, and you will have lunch provided at all days. And then we will basically go through the motions of presenting the case study, comparing the case study, and fine-tuning the means that we have presented in the first half to assess those preliminary primary healthcare centers. So I wish you the best of success in your case study and in your preparatory viewing of the modules. And I look forward to see you all at the Thammasat Design Campus by the 15th or 16th at least of July. Thank you very much and good luck.